Nigeria's exports are well known. Oil, gas, cocoa, and even gold, all popular. But so is talent. For decades, Nigerian talent has made its way out of the country and stayed abroad. And that's especially true for medical talent. In the United Kingdom, nearly 8,000 Nigeria-trained doctors are currently on the medical register. As of 2017, according to the Pew Research Center, some 348,000 Nigerian immigrants live in the United States. Nearly 4,000 of them are doctors educated in Nigeria. Since Muhammadu Buhari became president in 2015, more than 4,500 Nigerian doctors have left the country to practice in the UK. It's a similar story for Nigerian dentists and nurses. More than 15,000 Nigerian-trained nurses have obtained licenses to train in the United Kingdom since 2017. Nigerian medical professionals are also practicing across mainland Europe, the Middle East, South Asia, the Caribbean, and most definitely the United States. The Association for Nigerian Physicians in the Americas, or AMPA, is headquartered in the U.S. state of North Carolina. The nonprofit organization has some 700 members and represents nearly 4,000 physicians, dentists, and health professionals while providing a platform for scientific and medical dialogue on issues relevant to the Nigerian diaspora. I've come to Charlotte to speak to a group of Nigerian doctors who are members of AMPA about their decision to leave Nigeria and not return. Give me some background on the journey. You're obviously born, raised in Nigeria, initially educated in Nigeria, and you've made the decision to come over to the United States for more training and more education. And tell us about that process, that experience, why it is that you didn't return to Nigeria, what didn't Nigeria offer, what was in Nigeria that didn't, whet your appetite in coming back? Has that changed over the years? And how are you using your experience, your decades of experience as it stands now, to improve the healthcare infrastructure back in Nigeria?
I think it's a combination of factors. The quality of education in all universities, all government universities, appears to have taken a downslide. And also the fact that there's an emergence of private universities that have higher quality is a significant blow to the public universities. Retention of faculty has been a problem, and faculty has been attracted externally for a couple of reasons, one of which is financial, and the second is professional satisfaction. When you speak about people like myself who left with the intention of coming back, there has always been and continues to be that struggle regarding your patriotic desires and the reality of professional satisfaction, maintaining a family, and seeking the best opportunities. So it now comes down to a personal question. And for those who can make home wherever they are, it's easier for them to not go back. Most people who are born in Nigeria seek to return if it makes sense. But fundamentally, most people increasingly are struggling with the reality that returning may not make sense for one's specific circumstance.
It's not news that Nigerian Americans have attained significant achievements. And we at the Association of Nigerian Physicians in the Americas ponder about the Nigerian healthcare dilemma regularly for years. And finally really came to the conclusion that if we want to get the healthcare system that we're used to in the diaspora, for our families, for our friends, and even for us when we go back home, that is really important to deal with the governance issue. And so for me, I think this is most important. And governance comes with civic participation, civic engagement, meaning me, meaning you, going out there, getting our registering to vote and voting when the time comes. And I think that this is something that really Nigerians of higher socioeconomic status and diaspora can really drive. So one of the things that we did at AMPA was to create the Nigerian Physicians Advocacy Group. And really our mission or our mandate is to educate political leaders, to influence governors as a way to promote health. I think that COVID-19 has shown us that health care or health in general is tremendously important for economic development.
The United Kingdom has one doctor for 365 people. The United States has one doctor for every 375 people, while Nigeria has one doctor for 40,000 people.
There are challenges, as we know. We know that, like, of all the medical schools that are training physicians currently, there's just not enough providers for the population that is there to be served. You have thousands of patients per healthcare deliverer. During the course of the training, there are often interruptions that include separation of the student from being able to have a straight course of training. There's limitation in resources. I think that one of the things that we could do is to be a little bit more innovative, think outside the box. How can we train a larger number of personnel with what we already have? We saw that with COVID, that there was a disruption in not just medical education, but education all around. People had to go home because of social distancing. The whole economy and the care delivery system was put on pause. This requires the necessity of having virtual platforms to be able to engage training. So you have third-party situations where patients could interact, and then you have the medical student be able to see from that standpoint and learn, to be able to have simulation opportunities where you can simulate part of the training outside of the FaceTime and the in-class scenario. We know that Nigeria has some limitation in resources in being able to do these things. And so partnerships between diaspora physicians, foreign organizations, international and world-class organizations and academic centers could help create opportunities of learning. So we are able to have that interface of technology and knowledge and be able to mutually, it's not one-sided, to get what we do best as we've done. And as you know, during the Ebola epidemic, how well Nigeria did with the contact tracing and the epidemiologic work that went there, and then take from where we have advanced technology and expertise in subspecialties and have a two-way transaction of information to help enlighten both and to have us gain from both.
For most of the 42,000 doctors who are currently in Nigeria, the immediate reality is bleak. On average, Nigerian resident doctors earn around $600 per month, but many doctors in government-run facilities complain about earning far less. Thousands have gone on strike over unpaid salaries, poor facilities, and inadequate hazard allowance during the COVID-19 pandemic, issues that have continued to contribute to the number of medical professionals leaving the country. At the turn of the new millennium, Nigeria agreed to allocate no less than 15% of its budget to healthcare. Fast forward to 2021, and despite the COVID-19 pandemic, just 7% of the total budget has gone into healthcare coffers.
It is clear to any insightful observer that healthcare is not a priority in Nigeria by the leaders for the people. It is not a national priority. That is not an opinion, that is a fact. And I will tell you why I say that. The amount of Nigeria's revenue, Nigeria's GDP, that is allocated to healthcare is about 4% as of 2020. Prior to that, it was about 3.8%. It's risen marginally. It lags way behind international standards, but we must acknowledge that the international standards are relevant to westernized countries. But Nigeria's allocation to the health industry per GDP lags behind low-income countries and most of African countries. So it is an anathema if Nigeria, with its vastness of resources and size, does not devote adequate financial resources to enable the health of its people. And the health of our people, the human capital, should be the priority of any government. So that's one. Now, the second is that most Nigerians can't afford healthcare. They can't afford healthcare predominantly because there is no effective national healthcare scheme, it's called. National health insurance is in its infancy. And what we have today is about 3% of the population is covered by health insurance. And because of that, most people can't afford it to a point whereby more than 70% of Nigerian healthcare spend is out of pocket. So that demonstrates, first of all, a lack of prioritization. So secondly, for us to reverse this, to get to your specific question, it can be done if we address the fundamentals. There needs to be a deliberate infusion of capital from the government as well as the private sector in a coordinated manner, not in a reactive or haphazard manner, to support the health industry by some means. We're not suggesting that every single citizen should be expected to go to sophisticated tertiary healthcare centers. The fundamentals of healthcare delivery in Nigeria still revolve around primary care, around kids getting immunization, around clean water, around being able to get good food, around health literacy, primary health care. That there's lacking of coordinated primary health care. There's lacking of access to primary health care. And that's a government's responsibility. So one has to understand that the industry needs to be infused strategically with finances. And secondly, there needs to be accountability within primary, secondary, and tertiary health systems. But that has to be driven by a healthcare strategy that is purely theoretical. I mean, we have strategies. We have actually well-articulated strategies. But accountability to those strategies is weak. And the reality of executing on those strategies is also probably a pipe dream because there's no funding to make it a reality.
I am not proud of the healthcare system in my country, Nigeria. And I say it with all sincerity because I am a product of the healthcare system. And now I'm in America, and I cannot believe what has happened to our healthcare system in Nigeria, where we got a solid foundation, solid training. Access to care was adequate back in the 80s when I got my dental degree and my colleagues got their medical degrees. We had robust teachers who had trained overseas and moved back to our country, Nigeria, to train the future. But look at the future. We've all moved on to developed countries, to the United Kingdom, to the United States. So, to say the least, you would not expect access to be adequate. We have disparities. Because we have inadequate access to dental care, we have disparities. You just touched a little bit on that as part of your question. Those who have the means go overseas. And those who don't have the means, for lack of a better word, are left to die or, just take whatever they find. And that is disheartening. Currently, again, as the president of the Association of Nigerian Physicians in the Americas, the vision of that organization, of our organization, is a healthier Nigeria in a healthier world. Even for those of us here, we see the inadequacies in our healthcare system. We are out there trying very hard. How can we be part of policy making? How can we be part of the financing of healthcare system? How can we be part of of providing healthcare, quality healthcare to our citizens? How can we be part of making sure that our population, our people, get some level of care? You don't have to have all the money to be involved or to be able to get access to immunization, to preventive procedures, or have preventive things being brought to your doorstep or being made aware of preventive care. So these, the very basic things are lacking in our system, not because we don't have policies in place, but it's because we don't have implementations going on to actualize all of these things.
Doctors say the duty of governance is an important one.
I think Nigerians, whether living in Nigeria or the diaspora, need to change their understanding of what it means to be governed. I think that we must adopt a mindset that understands that in the democracy, the government exists to serve the interests of the collective and not the individual. And we must begin to reorient our thinking from proactive to reactive, and really begin to engage in the political processes that affect daily living.
But the medical landscape in Nigeria is changing for the better. New hospitals are cropping up around the country, albeit mostly in Lagos. The Private Sector Health Alliance of Nigeria, or PSHAN, seeks to deliver at least one global standard primary healthcare center in each of Nigeria's 774 local government areas.
The country will need a healthy population to help satisfy that, both produce and consume. And part of that is a sustainable, healthy population. And in order to get that, you need to create the infrastructure that enables that. So we build roads and we build telecommunication systems that are designed to last for a very long time, sometimes in perpetuity. However, in the Nigerian context, most of the infrastructure is designed with a very, very short-minded attitude to them. So in order to create a sustainable healthcare system and create the infrastructure to support that,
the greatest needs of Nigeria healthcare are primarily in the primary care sector. The primary care sector also has the largest potential to affect public health. It also gives you the largest return on each naira spent. It gives you the opportunity to affect in a positive way the healthcare of many more Nigerians. There are a few other things that sort of tie in with providing efficient primary care. Those include things like vaccination, treatment of infections, and clean water, power. A lot of these things that they are not big projects that you can point towards, but they certainly would in a positive way affect the health of many more Nigerians than a specialty tertiary care could.
It requires collaboration between the government agencies, the complex private sector. It needs a buy-in from the politicians, and you need funding, adequate funding and support and regulations to allow that to happen. Certainly, the government has a role to play, and the role of the government is to create the enabling environment that allows the private industry to be a part of the solution. The healthcare spend in Nigeria now on a per capita basis over the last few years has remained stagnant. It's about $84 per person per year, where other countries, European countries, spend about $2,000 or $3,000, depending on which country. And in the United States, we spend upwards of $9,000 per person per year. So there's clearly a deficiency in the total healthcare spend. So in order to bridge that gap, and understandably that the government cannot be the sole funder of the entire system, the government needs to create the environment that allows for-profit private industry to be a partner. Whether it's the primary care, healthcare delivery at the local government and the state level, or whether it's the big hospital, regional centers, or national centers of excellence targeting cardiology, cancer treatment, kidney disease. The government needs to be the enabler of such infrastructure. One of the issues that entrepreneurs run into when they're trying to partner in this kind of long-tailed endeavors like healthcare is that the funding capacities that are available to most of the institutions are not aligned with the long-term goal of creating a 10 or 20-year cycle of investment.
Among the doctors, there's certainly a feeling, a desire to return to Nigeria.
The number of physicians and dentists abroad are hungry to go home. And quite a number of the physicians are setting up hospitals, practices all around the country. If we can count 20 practices in 2021, I can guarantee you I almost count 25 to 26, all trying to bridge the gap of inadequate access to care.
I am somewhat pessimistic because, yes, if we were marooned on an island in the desert and couldn't go anywhere, if there isn't an introspective analysis, and from that you have decisions that are obvious and objective that are made to turn the corner, then the status quo will persist and will become just a new baseline. Currently, people can escape if you can afford it. If the industry does not innovate and transform, then even those that have money won't be able to get out.
I'm an optimist by nature, and I just don't believe that things can just necessarily stay status quo. Why do I say that about Nigeria? Is that Nigeria, with all its problems that we have had, we have made some changes. The telecommunication industry is an example. The banking industry is an example. Hopefully the electricity industry is the same. So Nigerians have made strides when they have come to change something. So we expect that with the healthcare industry, COVID has probably made anybody who is interested in wanting to aspire to lead Nigeria to get healthcare to the fore of the discussion. It should not be treated as an afterthought. It should be part and parcel, an integral part of what you plan to make Nigeria advance. And I'm hopeful that any potential leader who is going to come through, it's not just only going to be the president, it's going to be everybody, legislators. They will understand this conversation, that they all have a role to play. So I'm an optimist, but I can assure them, if you work on that, you have the diaspora healthcare who are going to give you the sole backing to make sure we can transfer that wealth of knowledge, the skills. We have them. The answers are there. You have the stories all the time about what the Nigerian healthcare workers are doing abroad. So we have them. And the final question, piece of that question, is that you have to create, the government has to help create harmony within the healthcare force. What works in most of developed countries, the doctors, the nurses, the lab techs, the pharmacists, they all understand the different roles they play because the focus is the patient.
True long-standing change happens at the policy level. So what am I talking about? You know, we've had examples from medicine, business, travel, etc. But what am I really talking about? I'm talking about Nigerians registering to vote and voting for people that have the capacity to bring about positive change, despite whatever perceived obstacles that there might be.
For decades, the road travelled by Nigerian medical talent has been stuck in one-way traffic out of the country. But with the general election, struggling medical professionals and patients are hoping for a diversion on the horizon, one that can show the route to how Nigeria can go from brain drain to brain gain. Adefemi Akinsanya, Arise News.